Hi, I'm Dr. Pachowiak, and I'm an interventional radiologist with IR Centers. I'm going to talk to you today about BPH and prostate artery embolization. So what is BPH? BPH is a benign condition of the prostate where there's enlargement over time. And this is very common as men get older. It's a very common condition to have. And it can be very debilitating and quality of life changing. It's associated with moderate to severe urinary symptoms where you can find yourself taking multiple trips to the bathroom, getting up at night multiple times, inability to completely empty your bladder, having a weak stream, and patients are often very unhappy. So what are the treatments? There's a wide array of treatments that we can use to treat BPH, starting with medication, which can work, but unfortunately comes with many unwanted side effects. And there's a whole wide array of procedures that we can do to address this problem and fix this problem, ranging from minimally invasive all the way up to prostatectomy or removing the prostate. The great thing about PAE, or prostate artery embolization, is it's the least invasive of all. There's nothing that goes through the penis. It's a small puncture in the femoral artery. There are no sexual side effects. There's no risk of having urinary incontinence. There's no risk of retrograde ejaculation. There's no risk of impotence. So it's a very attractive option for a lot of patients. It's also a pretty easy recovery. Most patients will have some increased frequency, increased urgency, some burning on urination, and that usually lasts from 3 to 5 days, but not everybody has these symptoms. What can you expect after this procedure? Most people won't have a significant improvement in their symptoms for at least 2 weeks' time. And by 4 weeks' time, most people should notice a significant improvement in their symptoms. But the whole entire process does take about 3 to 6 months. So if you're not feeling as good as you would hope by 1 month, keep in mind it can take a little bit of time. So how does prostate artery embolization work? It works by reducing the blood flow to the prostate. So how do we do this? We do an angiogram, take a picture of the arteries of the pelvis, and we locate the prostatic arteries. And then we place a catheter into each prostatic artery, and we inject these tiny little particles. And what these particles do is they act to block off the blood supply to the prostate. So the prostate isn't getting the blood that it normally gets, and so in turn, it will start to shrink down over time because it doesn't have what it needs to continue to grow. So what can you expect on the day of the procedure? You're gonna come in about an hour beforehand. We like that you don't eat anything or drink anything for 6 hours before because it's done under moderate sedation. You'll get dressed, you'll get some Valium to relax you, and then we'll bring you back into the procedure room. The procedure takes about an hour, and afterwards you just have to lie flat for 2 hours, and that's to prevent any bleeding from the puncture site, and then you get to leave with a Band-Aid on your leg.